I just want to thank Crohn's and Colitis Canada for inviting me today. This is something that is very near and dear to my heart, and especially just bringing attention to just mental health in general in individuals living with Crohn's and colitis. So I just wanted to start by kind of talking about what mindfulness actually is. I think mindfulness is a word that's being tossed around just about everywhere now. People are having these mindful minutes or mindful moments, but I think it's important to start with what it actually means. And to me, something that I want to highlight is it's more about just paying attention. People often will say it's paying attention to what's happening in the present moment. But that's not just about what's happening inside of you, but it's also what's happening in terms of your thoughts, your feelings, your body sensations, but also what's happening around you. And the key here too is that doing this with an attitude of kindness and curiosity. One of my favorite quotes of mindfulness is by Jon Kabat-Zinn, who has become famous for bringing mindfulness more to Western society through mindfulness-based stress reduction. And what he says is, in Asian languages, the word mind and the word heart are the same. So if you're not hearing mindfulness in some deep way as heartfulness, you're not really understanding it. Compassion and kindness towards oneself are intrinsically woven into it. You could think of mindfulness as wise and affectionate attention. So to me, when I think about mindfulness, what that means then is, yes, it's focused attention, but it's also an open awareness and doing that with a kind intent. And I also want to highlight something, because people also tend to think of mindfulness and they think, oh, I'm going to be mindful, and then suddenly I'm going to be completely calm and zenned out, and I'm not going to think about anything, I'm just going to be. But that's really also not what mindfulness is about, because it's not really about emptying the mind. Our thoughts are just running and racing all the time. It's about actually noticing those thoughts. And it's not about not having judgments, because human beings are judgy people. We're making judgments, and that's part of evolution and how we've gotten here. So much so that if you are under stress, the brain will automatically make you more judgmental. Because really, it's trying to decide really quickly what's going to get you out of this, get away from that thing that's stressing you out. I like to think of it as practice, really. So when you are trying to be mindful, sometimes you'll feel calm and at ease. And I see that as lifting a 10-pound weight and doing 30 reps. Sometimes your brain will not shut down and you will be thinking and you'll be having 1,000 thoughts a minute. And to me, that's just pulling up a 50-pound weight. It's all great practice. So I will say this, I'm not a neuroscientist. I'm not an expert in neuroscience, but pun intended, the research around this in the literature is mind-blowing. What they have shown with mindfulness and meditation, and this isn't necessarily just in Zen monks who meditate 24 hours a day. This is in people who have gone through sort of an 8-week mindfulness course. And what they find, and I think this is particularly important in IBD, is that in response to pain, there is less anticipatory stress and less self-reported unpleasantness afterwards. So if I think about IBD, well, let's translate that to a flare. If you have less anticipatory stress around the next flare, and then you're able to potentially have less unpleasantness after the flare is over, it might be a welcome approach to living with IBD. The other part that I find really interesting is the amygdala. The amygdala is a very small piece in the brain and often is associated with the stress response system, and that's what sets off that stress reaction. Research has shown that with mindfulness practice and meditation, the amygdala becomes less reactive and actually structurally smaller, which can have really big impacts in everyday life. It's also shown to improve immune function, it improves integration in the brain and efficiency in the brain. So this is just sort of a little bit of a taste of some of the neuroscience literature, but there's plenty more to show that it's beneficial. But what does that actually mean in everyday life? Like, sure, we can talk about brain structures and connections in the brain, but to me, it's about being more than your experience and learning how to respond to life instead of react. So really, awareness and that focus and kindness allows you to make decisions in the moment that are aligned with the person you want to be. So instead of those knee-jerk reactions that you might have when you're frustrated, it gives you the chance to make a choice on how you want to act. I also think mindfulness, in a way, teaches you how to fail, because you just got to keep practicing, and your focus will not stay. Say you're trying to focus on your breath. Your mind is not going to stay there. Your mind will wander. That's what minds do. But you are continually bringing yourself back. And I think that practice in recovery and sort of practicing something that ultimately is challenging can be really a helpful skill to develop. And I think ultimately you get that space where you can be the peace amongst the chaos. You can have things happening around you. It can be in my case, a very upset toddler or preschooler who's just screaming because you gave them the wrong color of plate. But instead of getting frustrated and just thinking to myself, like, it's okay, it's a purple plate, you can actually pause and remain calm. And that has an impact on the people around you. That also works in awkward business meetings or in personal interactions that might be difficult conversations to have or frustrating conversations to have. But what about right now? Now, I'm not going to bring out a bell and get everyone to kind of sit cross-legged or to focus on their breath, but just even right now, just notice, are your feet on the ground? Do you notice how the chair is supporting you? That might be the backs of your legs, or your back, or your bottom. Check in with your body right now. Are you carrying the day with you? Are your shoulders tense? Are you slouching or sitting up? Just being aware of your body right now. And if it feels comfortable, just taking a moment to connect to your breath. Can you feel it? This might be something you feel internally, whether it's at your chest or your belly, but it might be externally as you breathe in, your clothes get a little tighter. You breathe out, and it gets a little looser. Just inviting you guys, even right now, just be here. Don't be in tomorrow's meeting. Don't already be in bed. Just kind of being here. So that was even just a little taste of what practice can look like. And it can be something that can be done anytime, anywhere, any place. I truly believe that any action can be leveled up with mindfulness. Because ultimately, some people are never going to want to meditate, right? There's some people who are never going to want to sit on a cushion and focus on their breath, and that's not realistic. But there's another option where you still get the benefits, and that's just practicing engaged mindfulness. And how do you incorporate mindfulness and practicing those skills in everyday activities? One of my favorite ways to do this is to actually listen to people. How many times, if you were to think and be honest with yourself in a conversation, you already know what you're going to say before the other person's done talking? I just challenge you guys to try if you were to just suspend that for a moment and truly listen to somebody. You'd be surprised when you're listening to understand versus listening to respond, that other people can feel the difference. This can be, you can level up eating with mindfulness. That might be taking a moment before you eat just to actually get a sense of, what does your food smell like? What had to happen for that food to get to your plate? Did somebody have to cook that for you? Was it something that the sun had to help grow, or the rain, or anything? Just putting a little bit more thought into something and really tasting the food, as opposed to kind of shoveling it in your mouth while checking emails or getting dressed in the morning. The other thing I like to think about in the context of IBD is, say you're walking towards a colonoscopy. Don't be in the colonoscopy any longer than you need to. If you're walking there, just walk. If you're waiting, just wait. You're gonna get there eventually and you're gonna have to do it, but there's no need to spend extra moments in that headspace. I also will encourage you guys, if you're really joyous or happy about something, actually allow yourself the space to be there and be happy and not move on from that emotion right away. And just savor it. I think we have this go, go, go lifestyle where efficiency is rewarded, and we don't allow ourselves the permission to just pause for a moment. You can pause. It doesn't have to be meditating for 45 minutes a day. It can be just that one moment. And that one moment might be all you need to be able to decide in that moment how best to care for yourself, or what choice can you make that's going to be most aligned with the person you want to be, or moving towards what is most important to you in that moment. This can be helpful, especially in the context of IBD, when there's just so much uncertainty and you need to navigate gray zones all over the place because nothing is black and white. If you're clear on what's important to you and what really matters, having that space to decide, is this moving me closer to that or further away, can give you that space. I also think with IBD, you can't outrun your thoughts. You can't outrun the unpredictability that many people with IBD have to live with. And I just don't buy that silver linings work when you're living with IBD, because sometimes a flare is a flare is a flare and it's awful, right? But I also think that if you start having symptoms of a flare, it may not be helpful to think about how terrible the last flare was, or how long it lasted, or predict how long this one might last. I think kind of pausing and taking stock of where things are now and then making choices based off of that. The other piece about mindfulness that I love is that the more you practice, the more you benefit. So in research in mindfulness, what's really interesting and can set it apart from other types of therapies is that patient-reported outcomes continue to improve even after the intervention ends, because they've incorporated the skills and they get better and better as it goes. In IBD in particular, practicing mindfulness also gives you a shot at preventing mental health disorders. As a health psychologist at Sick Kids, my goal would be able to see kids and teens before they have an anxiety disorder or depression. I want to be able to catch everyone when things first start not feeling so great or something doesn't feel right, and then being able to teach them these skills to prevent those issues from developing. And also, stress is a trigger for many people with IBD, not everyone. I've met many people who can be under enormous amounts of stress and it does not impact their IBD. But for many it does. And mindfulness, and I will bring back John Kabat-Zinn, who developed mindfulness-based stress reduction, that was actually developed for stress. So for those people who find that stress is a trigger, learning mindfulness skills can be really helpful. The other piece I want to bring up is just pain. And living with IBD, you have to go through pain. And pain in IBD is meaningful. So if I were to have a stomach ache, my first assumption is it was a bad tuna sandwich. But I think for many people who have had active disease, it's very reasonable to be like, oh, like the stomach cramping, like is this a flare? What's happening next? And then predicting out. I think our brains are just constantly telling us stories, and thoughts aren't facts. they may be true, but they may not be. So in those moments where you are experiencing pain, mindfulness allows you to prevent yourself from just adding to it. So pain can be the physical sensation, but it doesn't have to be the disappointment on top, or the thoughts of what did I do to bring this on, or what could I have done differently, or all those other things that can layer on and make the experience of pain worse. I'm not going to try to say that mindfulness is going to take away symptoms of IBD or pain, but it can change the relationship and perhaps have that pain not be so impactful or not be so unpleasant in the moment. It's about investigating it, just noticing what's there, allowing it to be there, allowing it to have space, allowing it to leave, and then just being kind to yourself. Because there are times that it is bad, it is awful, but you're also not the only one who feels this way. I do want to highlight some of the research that's going to be coming out of the Sick Kids IBD Center and what sort of led me to focus a lot of my clinical work in mindfulness-based interventions for kids and teens with IBD. So what we've done is we've interviewed, to me, all the experts. We interviewed the teens themselves and their parents, and also some healthcare providers who specialize in IBD. And one of the themes that come back again and again and again in terms of how can you be resilient in the face of IBD, things that came up were acceptance, being open about it with yourself, maintaining your identity. So whatever it was you were doing before, if you were a soccer player, still play soccer. If you were artistic, still be artistic. Like, don't lose those joys in your life. And also meaningful social support and lessons learned. So walking away from a flare with some lessons learned as opposed to sitting in a space of what could I have done differently, or what did I do wrong? The other thing that's really interesting that's coming out is that what we're finding is that for individuals who have IBD, pain rumination, so that's when you keep thinking about the pain and you can't stop. So when is this going to go away? I can't take this. How much longer? Those kinds of thoughts can be really detrimental and impact quality of life. But if you are mindful, that relationship falls away. So people who develop mindfulness skills are not as impacted by pain ruminations, and that improves their quality of life. I think also thinking about parents. Parenting stress is positively associated with certain parenting behaviors. And when parents are under a lot of stress, those have been shown to actually impact child-reported quality of life negatively. So when parents are very stressed out, they're engaging in certain behaviors, and their kids' quality of life suffers. At higher levels of mindfulness in parents, this is no longer the case. So even though they have stress, that stress does not impact their child's quality of life. So I've found that often with parents, the best way to get them to take care of themselves is to convince them that it'll help their kids, because getting parents to look after themselves is a challenge. I also want to just review some of the research coming out in terms of the intervention. So at Sick Kids, we've run mindfulness-based groups in person and also mindfulness-based groups online, because quite frankly, people have IBD all over Ontario and all over Canada, not just in downtown Toronto, and getting to Sick Kids with any regularity is really inconvenient for most people and not really feasible. And what's really lovely is what we found is that kids who went through this program, it was a 6 to 8 week program where they meet in a group. There's generally like 8 to 10 teenagers who get together to learn mindfulness skills. What they found is that their emotional functioning relative to IBD, so how they feel about their IBD, how they feel about the procedures and the surgeries and the medications, those all improve. So it's not that mindfulness takes away the fact that you have to do these uncomfortable things. you're just not as bothered by them. And similar to the previous studies, we found that pain catastrophizing, ruminating about the pain, so those negative thoughts about the pains, those also decrease. And what's really great is a lot of these teens who went through the program just talk about how they actually implement mindfulness throughout their life. It's not just about IBD, so they use it a lot for things like school. And for teens, it was really meaningful to be able to meet other teens who also have IBD and learn from each other. So just to give you a bit of a sense, one of the quotes from the kids is, "I guess I go into situations a lot more mindful. I always think before I act now, and before I say something, I kind of see a huge difference in the reaction that I get from people. So like the benefit wasn't just for myself, but other people noticed it too. And I got a good reaction back. So I definitely controlled the situation better. And we learned it in relation to IBD, so I was able to use it in other ways as well." And I'll give a little context to the next quote. In one of the mindfulness activities, I work with children and teens, so I try to make things as fun as possible. And I actually teach them a meditation where they need to hold on to ice, which may sound a little bit bizarre, but it can feel uncomfortable, but it's not quite painful. So it's a great way to explore and learn the skill of being with something uncomfortable. So in this quote, we did this thing where we held onto ice cubes and focused on the pain of the ice cube in your hand and how to sit with that pain instead of trying to ignore it or push it away. And I actually found that really helpful. Just being aware of what's going on without needing to separate myself from what's going on. When I'm feeling stressed about something, what's the worst that could possibly happen? Then I think it's not so bad, that's okay. And I kind of think the ice cube brought that. I don't know how to explain it. Holding that ice cube, it's painful, but also it's gonna melt. So I can hold it and know it's gonna go away. So as I said, what about adults? I'm a pediatric psychologist, so my expertise really is in children and teens and young adults. But I did want to look and take some time to seeing what's out there in IBD and mindfulness with adults. And it's really quite an exciting time because there is some literature coming out, but it's still really in its infancy. And what they're finding is some of those similar patterns where in an analysis of all the studies that have been done up until 2019, really what they're seeing is that it improves stress, not just in the short term, but the long term. But what's really interesting is that they are showing improvements in depression and quality of life, not necessarily in the short term, but in the long term. And I think that speaks to the fact that they're learning this skill, that the more they implement into their life, the more benefits that they see. Now, I will highlight this. Most of the research at this point has been done in people living with IBD who have fairly low disease activity or are in remission. And a lot of the studies have really targeted individuals who have IBD, but also IBS or some additional functional abdominal pain. So mindfulness tends to be particularly helpful with symptoms of IBS and functional abdominal pain. And I think that follows. I'm not going to try to tell you that mindfulness will take away the symptoms themselves. It's more about your relationship to the symptoms and how you react to them, and teaches you how to respond in a way that is aligned with who you want to be and how you want to act. So I'm really excited about the study that was funded over the summer because it's targeting parents. I think in pediatric institutions, and I'm not sure, I won't speak to adults, institutions, and caregivers, but I think often caregivers and parents don't necessarily get the resources because they're focused so much on their children, they're not thinking of themselves. So what we hope to develop over the next year is a manual where it's going to be 3 sessions, 90 minutes, where it's really about skills training and teaching parents some mindfulness skills and how to implement those mindfulness skills in order to be the type of parent they want to be in that moment. Now, my ultimate goal is just to create something that's doable and that parents will actually show up for. That is by far my priority at this point. And I think as part of that, my hope is that what we can teach in these 3 sessions is really those foundational skills that they need that parents can go away with. I also know that at Sick Kids, I have the good fortune of having a dietitian that works with me. So she actually helps run some of the sessions so that, yes, this is about mindfulness skills and living a life that is meaningful to you, but we get to discuss healthy eating habits and how to support overall health. So I just want to challenge everyone, wherever you are, just be here. And when you're with your children or your family or your extended family, just be there and see if that changes anything in your experience of day-to-day life. Thanks.